This surgical robot could transform how doctors diagnose and eventually treat lung cancer. Auris Health, a startup in Redwood City, California, developed a robot to perform endoscopies, a procedure that allows doctors to look inside the patient's body using a microscopic camera attached to a tubular device. The robot, called the Monarch system, features an endoscope that extends like a telescope through a patient's narrow airways. Physicians can maneuver it with an Xbox-inspired controller. Computer-assisted visualizations help doctors guide the endoscope precisely where it's needed.
This is definitely not the first application of robotics to endoscopy, but our endoscopes are able to navigate further into the body than traditional endoscopes can. And because they're telescoping, and because we have the additional degrees of freedom with respect to how they articulate, you have direct visualization, precision, and control very far into the body.
Right now, the Monarch system is being used to help diagnose lung cancer at the earliest possible stage.
We chose to focus on lung cancer first and foremost because today when lung cancer is diagnosed, it's often diagnosed at a late stage. This 5-year survival rate is actually less than 20%. When you look at those patients who are diagnosed earlier, that number jumps considerably to over 50% survival rate at 5 years.
Eventually, this robot could go beyond diagnosis and actually perform surgery.
Our ambition is definitely to be able to both diagnose and treat lung cancer in a single setting one day. That's ultimately the holy grail for patients who have abnormalities of the lung.
The Monarch system attained FDA approval in March to diagnose lung disease, so don't be surprised if it becomes a common sight in hospitals soon.
We think that the technology is going to do two things ultimately: improve patient quality of life and extend it wherever possible.